Hello. Good morning. You don't have to turn on your camera if you don't want to. Um, but what we're gonna do is get started with our first community call. So this is for any of our clients, past or present. And part of the reason I'm doing this is I want to be able to connect with you guys more and answer questions and share what often feels like a lot of the random information that lives in my brain. So, this is an opportunity not only for us to connect, but you to connect with other clients who we're working with, as well as pick my brain about anything. If there is something I can help with, I am more than happy to do that. You are welcome to put questions in the chat as they come to you. If you prefer to unmute yourself, we can have a conversation. I love that. And I had one question that got submitted that I want to read to you guys and answer for somebody who couldn't be here so that they can catch the recording as well. And this is something we're planning on doing on a monthly basis. So you'll always have access. This is going to live in the virtual education library, and I'll send an email out afterwards letting you know that it's ready and where to find it as well. So the first question I got was about the role of dad's health when it comes to fertility and how much it can impact pregnancy or ongoing health issues for baby, particularly when dad is of an advanced age, so thinking over 45, and maybe has some terrain issues. So they're thinking about having another child and just really concerned that there might be something that isn't inherently going to potentially go wrong. So when we think about male fertility, it's always 50-50 when we think about female to male health. It's very important, but we often only think about the female side of things. With age, there has been a good amount of research done showing that there can be health implications for children. So particularly thinking about like an increased risk of things like gestational diabetes, but also thinking about more susceptibility to genetic abnormalities, or even genetic abnormalities, more like abnormal presentations for children once they're born, right? But the thing to keep in mind is that a lot of this has to do with oxidative stress. So anytime we're thinking about oxidative stress for men, it can impact semen health and sperm quality, and therefore the ability of genes to express appropriately. They had also mentioned that they think that there might be some terrain issues for dad in particular. And so one of the things that we often see for men when we're working with couples around fertility is that the male factor might have abnormalities as far as like morphology or motility being suboptimal, and those typically come back to terrain issues. So thinking about some type of toxicity in the body that's causing oxidative damage or oxidative stress, and making an increased need for antioxidant support and detoxification. The other thing that I think is always important, regardless of this being male or female related, when it comes to age, is mitochondrial health. So often we hear that women have a biological clock that starts ticking after they turn 35. But what we often see is that women can get pregnant well into their 40s, and this has a big part of what's happening with mitochondrial health. If mitochondria, being the powerhouse of the cell, are unable to produce ATP at adequate levels, it's very hard for not only those cells, but also organ systems to function. And this is especially true when we think about those smallest levels of eggs and semens and their ability to function properly and do what they need to do. So hopefully that is helpful. I know a couple of you joined after. You're welcome to put questions in the chat. You are welcome to unmute yourself, or you can just listen in. But I want to open it up for questions for you guys, and you pick my brain about anything you want, protocol related, not protocol related, mold in your house, anything at all. Any considerations in health impact for men who have had a vasectomy? Are we thinking about things that might be adverse effects that aren't talked about in particular? Perfect. Okay. So it is not uncommon. I think the two that come to mind for me are there can be a lot of pelvis, urinary, or testicular pain. that comes after a vasectomy that's not often talked about, and there isn't really a true resolution besides maybe reversing it. And I think this has to do with the way that fascia creates tension in the body. So anytime we sever those vas deferens essentially to do the vasectomy so that sperm can't travel, that can just create scar tissue. And anytime there's scar tissue, there can be fascia tension. That can cause a lot of structural issues, which lead to the pain. The other thing that I have seen a good amount of research on is the potential for increased incidence of prostate cancer as it relates to having vasectomy. So I don't know the exact statistics on this, but I know that's one of the big concerns that often comes up is that that can develop. And I think part of that has to do with the fact that very similar to when we think about breastfeeding or breast milk or menstruation, those are drainage pathways for women. Semen excretion, knowing that there's not only sperm, but we're also thinking about like the ejaculate as a whole. That is another type of drainage pathway. It's not like a huge one, but it is something that is necessary, especially when men are still of the age where they are continuously producing sperm. So those are the things that I would look into. When it comes to alternatives, obviously we have access to hormonal birth control, not great for women. Thinking about things like fertility awareness method can be really helpful. It is a little bit more tedious. Using something like a temp drop would be an alternative, or just some type of like obstructive contraception, which is not always the funnest, but does work. I don't know about reversing. The question is, would reversing a vasectomy reduce the risk of prostate cancer? I would assume so, as long as ejaculation is able to occur. But I am not positive, to be honest. And this obviously doesn't happen for everybody, but something to be aware of, and just know the risks. What else? All right. I got a couple here. Can you go over a bit about different services we're offering? It's been a while since we've worked together with this client. So we're still doing one-on-one work. We're going to be transitioning here in a couple months, so I'll tell you guys more about that in a couple of weeks, but we're working on doing kind of a hybrid program where we're going to have personalized care. You'll have a primary care practitioner, and then you will also have group and more community involvement as well, which we're really excited about. But right now we're still doing one-on-one work. We have intensive options as well as 6-month options. As established clients, if you have something come up where you want to do something like a lab review and get a protocol, but you feel really good about putting things in place, we can also do that. So it doesn't require as much of like a time commitment, or like a time duration commitment, kind of give you your protocol, and we trust that you know what you're doing. You've gone through a pretty intense protocol with us already, so you can put those things in place. Those lab protocols, as a reminder, they are currently a 60-minute lab review, and they are $300. You can do any labs that you want. So blood work's very popular, but if you're thinking about, hormone health, gut health, toxin testing, we can talk about all those things as well. We try to limit those lab review calls to 2 labs being reviewed in that call, just because it's a time issue more than anything else, that we want to be able to go through it in depth and also give you your protocol. So if you want to do more than that, it just might mean that we need to do additional lab testing. So those 60-minute calls are currently $300. That's the pricing for throughout the rest of the year. Starting in January, the pricing is going to go up for those. If I am not mistaken, I can't remember the number right now, but we're changing them to a 90-minute call, and they're going to be slightly more expensive. I can't remember if it's $400 or $450 for that call, but we want to have more time with you. We also know that we haven't updated those lab review pricing calls for all of 2024, so we want to be able to do that. So that's an option as well to consider. Her second question is, if her goal is weight loss, what should her first step be? She had a baby 11 months ago. Assuming that we're thinking about weight that was gained with baby, everybody gains weight differently when it comes to pregnancy. So typically what happens is, if you were underweight prior to conceiving, you're going to gain more weight. So I know oftentimes when we think about pregnancy, OBs in particular, even midwives, will talk about like the normal amount of weight to gain usually falls somewhere between like 20 and 40 pounds. And so if you gain more than that, it's a little like concerning more for you as a woman. I had that happen. I gained 50 pounds when I was pregnant, and that was normal for me given like where my normal body weight was. I would be thinking about how much you're able to be nourishing yourself afterwards. So, one of the things that anybody who's a mom knows is self-care is incredibly difficult when you have a new baby, especially I would say in those first 6 months, but honestly, those first 12 months. And so, self-care, rest, making sure you're getting adequate sleep can go a really long ways. I would still always go back to the basics as far as making sure that you are nourishing yourself with protein dense meals, first and foremost. Um, and then if you have not yet had your thyroid checked, I would also check that. So postpartum hypothyroidism is incredibly common, and this happens because of a drastic hormonal shift that occurs when we give birth. So when we give birth to the placenta, there's a hormone drop that is greater than at any other point in a woman's life. That includes menopause. And so that big drop in combination with additional stress of having a new baby, especially when it's your first baby, puts a lot of stress on the body and hormones. And we know that hormones don't function in a bubble. So when those hormones swing, we know that the sex hormones are also going to be impacted, as well as the thyroid. And so when that happens, it's not uncommon to see the thyroid not come back into balance fully. So testing your thyroid is something that I typically recommend somewhere after 3 months postpartum. So 11, 12 months is totally okay, but making sure that things are in a good spot and have returned to your baseline. Even if you were like slightly hypothyroid before, you just want to make sure that it hasn't gotten worse, and that might be a huge step that has nothing to do with what you're doing as far as diet or lifestyle goes. The other big thing I would say there is we're thinking about weight loss postpartum. It is really easy to rush back into exercise, and often you don't need as much as you might think. So even doing something as far as like 3 times a week, doing like body weight resistance strength training. It does not have to be high intensity. You do not need to be running or doing an intense amount of cardio in order to lose weight. We're really thinking about somewhere in the ballpark of like 30 to 40 minutes of exercise where you're using your muscles in particular, which is also going to increase insulin sensitivity to help with like blood sugar management as a whole. How long after baby should one allow the body to heal before another one? This is a great question. This is going to be really dependent on you and what your family's goals are, right? And what we know is that everybody responds differently to pregnancy. So when we are pregnant, give birth, breastfeed, if any combination of those things have occurred, whether it is one of them or all of them, there is a huge loss of not only nutrients, but minerals in particular. And it takes time to build those mineral stores back up in particular. So one of the best tests that we often recommend for women postpartum is called an HTMA. Many of you have probably had this done. It's a hair tissue mineral analysis, and it's going to look at not only your macro minerals as far as calcium, magnesium, sodium, and potassium, but also some more trace minerals. It also screens for heavy metals, which can be helpful if you haven't ever had that done. But it tells us about those mineral levels and where there might be depletion so that we can give you specific supplementation recommendations to restore those. In terms of time duration, everybody responds differently. So it might take you a few months to get in a good spot where you feel better. Some people, have conceive their second child within a year of having their first. Typically, what the research shows is that having at least 2 years between pregnancies, so end of pregnancy to beginning of pregnancy, is at least optimal for ensuring that the mother is able to be replenished. Now, this doesn't work for everybody's timeline, and if you have kids who are closer together than that, doesn't mean you did anything wrong. But there's a great book if you guys are interested in this. It's a very nerdy book, but it's called Deep Nutrition. And she talks about how there's this sibling factor where not only will you see more health issues when children are spaced close together, but you can also see changes in the way that siblings appear physically based on that mineral deficiency. So when children are close together, you'll start to see more asymmetry in their faces in particular, and that can be a sign that there is a nutrient deficiency in utero in particular. So something to think about. I will also add that like traditionally cultures space their children out even farther, more like 4 to 5 years apart. It just depends. Because I would say, like, I think everyone talks about the first 6 weeks of postpartum is when you heal. I would say it's a year, personally, where you start to like feel like yourself again. I have an almost 4.5 year old, and I finally am like, I feel like me again, right? So everyone's totally different. So I would take that into mind too, and just check in with your body to see what makes the most sense for you and how you're feeling, and if you feel good about having another one. That's exactly how, yep, totally. Um, any thoughts on how to increase breast milk supply? Going back to work soon and can't seem to produce enough to create extra for when we need it. Yeah, so for two things that I always recommend, make sure you're drinking enough water, make sure you're eating enough. Um, it's very easy to fall into that trap postpartum where it feels like, okay, I want to lose weight, I want to bounce back, I want to go back to work, I want to feel like myself again, right? And so it's very easy to restrict calories. If you are breastfeeding, you should be eating around 2,500 calories minimum per day. Now, ideally, what's happening when you are breastfeeding, whether you are pumping or breastfeeding, is that um, when that is happening, you should have like these intense like thirst and hunger cravings, which is a hormonal response that your brain is saying like, "Hey, we're producing milk, we need nutrition." If that's not happening, it just means there might be a disconnect in the way that your brain's communicating satiety cues for you. So I would first focus on that. Um, in terms of others, let me look really quick because I know that Elise on our team has some great recommendations for products for this. And I might have to find them for you, Jess. Um, because she is a wizard at this and she had some of those same issues. I will send them to you so that you have them. Um, how to focus on those satiety cues. I definitely don't feel them super strong. Good to know though. Yeah, so I think the biggest thing is okay, so anytime you're breastfeeding or pumping, if you can get into a really relaxed state, ideally what's happening when you're breastfeeding is like you're looking at your baby and you're like, oh my God, they're so cute. And you're having this big oxytocin surge that occurs, which is why oftentimes when moms are pumping away from their baby, they'll look at pictures of their baby. That can be really helpful. Anything that you can do to promote like safety and calm in your body while breastfeeding or pumping can go a long ways. And those same things are going to help promote those satiety cues. Um, so even, I know you have a young baby. It can be stressful to feed them, right? They need a lot of attention and they have a lot of needs at that age. Her baby's about 3 months old, I believe. So we, as much as we can, like calm our nervous system, whether it's like taking deep breaths, doing some type of tapping, doing things that can be really helpful as far as herbal supports. One of my favorite ones when I was early postpartum, well, there's two. One is called Emotional Ally from Wish Gardens. It's an herbal. It's safe for pregnancy, or breastfeeding, it's safe for breastfeeding. It can help just like kind of take the edge off of things if you're feeling really anxious. That can be helpful for your nervous system. And then the second one that I would consider is a high quality CBD. Um, I use Med when I was early postpartum. They have a liquid. I think the one I use is called their de-stress blend. That can be really helpful for like just taking the edge off and like calming things down. That's something that you could very safely do at the start of breastfeeding because those things aren't necessarily going to be ingested as quickly. So it's not going directly into your breast milk by any means. And there's a lot of research shows that those cannabinoids are also safe there as well. So that might be something to consider. And that'll help with the satiety cues. The other thing I would say is if you're not having those satiety cues, you're not like, oh, I'm not thirsty, I'm not hungry, put yourself on a schedule. I had to do this where it was like, I'm not eating enough. I was losing weight like crazy and it didn't make any sense and was getting into a really, really depleted state. And it just had to be like, I'm going to have a protein shake every single day at this time, even if I'm not hungry. I'm going to eat breakfast at this time, even if I'm not hungry. Same thing with lunch. It's very easy to lose track of your day. So, like, having a schedule for yourself that's like really focused on self-care and knowing that nothing functions if you don't can be really helpful. Perfect. Yeah, Lindsay, I see you.
Ah, Hi, Deidre. I have a question about mental health and pregnancy. So I'm 4 months pregnant, thanks to Michelle on your team. Um, and I wanted to ask your opinion on this. I know you can't like prescribe or suggest anything, but I wanted your opinion on this because my first trimester, I had some what my therapist call like depressive episodes. And now like I'm fine, or at least I seem to be fine. But one concern that my therapist and doctor had is postpartum. They said like first trimester and postpartum are when, you can have some depression issues. And so I've never had this before. And of course, the first thing they're suggesting is Zoloft, and to start taking it before delivery so it gets into your system. I would like to not do that.
Yeah.
um, Wanted to know like if you have any maybe other suggestions or like just what you thought about that.
Yeah, absolutely. So when I was pregnant, this was a big concern of mine. One of my biggest fears in becoming a mom was having postpartum anxiety or depression. So, um, what I would say is, I love that you already have a therapist. I would start talking about those concerns that you have. So that was one of the things that I did was I established care with a therapist while I was pregnant to start working through things. One of the things that I think a lot of women don't realize when they get pregnant is like all of your shit comes up suddenly, right? Like all of your familiar stuff, like all of the stuff that you like have fears and concerns of like moving into that phase of life totally come up. And so I think having a space where you can talk about those things can be incredibly helpful. And I think there is a natural grieving process that happens, right? Like you're leaving some things behind, you're getting some new things, you don't know what those things are going to look like. Pregnancy and moving into motherhood is the biggest surrender that you'll probably ever do in your life. So I think knowing that can be really helpful of like, maybe I'm not crazy, right? I'm not losing my mind on this. I think that alone can be helpful. I would start thinking about the things that, like, if there are things that are triggering you right now, as far as like depression or anxiety goes, recognizing those and having a plan in place or knowing what those triggers might be in the future. The other thing I will say is that there can be huge mineral issues when it comes to postpartum anxiety and depression in particular. So I can't remember if we did an HTMA on you. No? Okay. So you might consider doing something like that, or even running some updated blood work to look at copper and zinc in particular. Those two minerals balance each other out. So if they are out of balance, for instance, let's say copper is really low or high, it can cause more emotional presentations as far as anxiety and depression. So there's also another great book that you might really enjoy now that you're pregnant. It's called The Postpartum Depletion Cure. It's a fabulous book, but it talks about the ways that often women in postpartum, there are things that get like very similar to all medical world gets called normal. They're very common, but they're not actually normal, right? There's actually a root cause of it, and minerals and nutrient deficiencies can play a big role. So especially if that's starting to come up now in pregnancies, like you're 4 months along, like getting to that midpoint, might be a good time if you haven't yet done blood work with your provider. You can always ask to add things on. If you would like us to run additional markers, we can always help with that as well, just to see where levels look so we can like prevent anything from coming down the pipeline in the future. Um, those would be the big ones that I would think about. Minerals are always the first place to start, and then like having some level of care in place, which you already do, can be helpful. Um, I don't know how long you've been working with your therapist or how much you enjoy them, but if not, if you're kind of like on the fence and it just doesn't seem like they kind of know what to expect out of going into that phase of life, it's always worth exploring and looking around to see if somebody else might be a better fit as well.
That's great. That's very helpful. Yeah, my therapist actually is like PSI, like postpartum, whatever, certified,
Awesome.
has specific experience with that. And then just my last question is, how do you feel about Zoloft?
I don't know a whole lot, honestly. I think there's a time and a place for everything to include Zoloft. So I think if there if it's getting to the point ever where you're feeling like suicidal or like you're going to harm yourself or others, then I think, of course, like that always makes
Right.
sense. I think that those tools are really great short term and they do have negative impacts long term in terms of depletions as well. So it has to be like a case by case basis. Very similar to like taking antibiotics or something like that, right? Like, is this life saving? Yes. Okay. Well, then of course that makes sense, right?
Right.
But long term use, I would say like I would try as much as possible to, I don't want to say like, I would try to go into postpartum with the expectation that everything's going to be okay versus the expectation that something could possibly go wrong, right?
Yeah.
And I think that that's true of like, I feel that way about all interventions during pregnancy of like, we should assume that everything's good rather than like assume that things are going to go wrong because it creates stress for you and stress is not great when you're pregnant. Um, I think there's a lot of other ways that you can support yourself. Like some of those herbs that those products that I was mentioning, those would be
Right.
great for you for postpartum
Emotional.
anxiety and depression. Yep. Those would be great. There's another one, I can't remember what the other one's called from Wish Gardens, but they have one that's very similar, different blend. Using things like adaptogenic herbs can be incredibly helpful as well. Lots of magnesium, like lots and lots of magnesium when you're postpartum can go a long ways, varying types.
And omega-3s.
Yes, omega-3s.
Thank you so much. I actually am thinking about doing some blood work with you guys and just kept getting like a gut check at this point, just to see about my minerals.
Yeah,
So that's, thank you so much.
yeah, of course. Emily says healing from mold is a very, very long journey. Once 6 months is over, is there a discount to continue care? So you have options. You don't have to commit to another 6 months after you finish your 6 month program. Typically, what we will do is you can either do um, ongoing care that is month by month, essentially. So typically, the way that we do that is you have two options, and we will bill you for 3 months at a time, but you can cancel at any point. So you're not committed to those 3 months. It's just a little bit easier so that we don't forget to send invoicing. But you can either do the same level of care, so you can still do biweekly calls. It's the same price per month, or you can drop it down to a single monthly call that is 45 minutes instead. So just to give you a ballpark, the biweekly calls for twice a month is 500 per month, and then the monthly call is 375. It still includes follow-up care, so like if you messaging your primary practitioner, asking questions, things like that, you can do that. You also don't have to like necessarily start right away. So if you're like, hey, I kind of know what I'm doing for the next month or two, but I want to pick up again in a couple months, we can do that as well. There's one here, natural remedies for acid reflux. I have random issues with it. It may last a week or more, then it goes away for a month or more. Not positive on what the trigger is. In terms of symptom relief, I'd be thinking about deglycerized licorice or DGL. Usually you can grab this at like a local health store. You can take that when you feel it in particular. That can be incredibly helpful. I also love things like slippery elm tea or aloe vera juice. Again, you can usually get that at a local store. And you would just want to do those like leading up to a meal. So if you're like, it's my month, I have bad heartburn, you want to do those before meals. What those are going to essentially do is soothe the gastrointestinal lining, particularly in the stomach, to help kind of like heal that and make it so that stomach acid can be produced appropriately. And then there's another product called Gastrozyme. This is super, super safe. Anybody can use this. Also breastfeeding safe as well. Gastrozyme is a tablet. You usually want to take like 2 tablets before meals. It's green in color, so it can also turn your stools green, just a heads up on that. But it has spirulina in it, and spirulina can be incredibly soothing of the GI tract as well. Now, then I would say you also want to think about if there's potentially a low stomach acid issue that's contributing to that. So ideally what's happening is that stomach acid is being produced at adequate amounts to digest food chemically and then leave the stomach. But if it's not achieving that optimal level of acidity, it doesn't move into the small intestine. So it'll basically just stay in the stomach, continue to churn, and then what happens is the sphincter that's at the top of the stomach opens up, and then you get it back into your esophagus or your mouth and get full-blown burning, right? So it may be more of a low stomach acid issue, in which case you could use something like, you could use like papaya enzymes to start with, and then moving into something like HCl when you are asymptomatic. So, meaning that you are no longer having that reflux. We don't want to increase the stomach acidity when it is still coming into the esophagus and in the mouth, because those tissues actually aren't designed to withstand that type of acidity, which is why it burns and is painful. So I would start with like the Gastrozyme, the DGL, slippery elm, aloe vera juice. And then the other thing that I would say that can be used in small amounts, on like an as needed basis, but not daily, is you can also take just a little bit of baking soda and put it in water. Baking soda will calm down that acidity and give you a lot quicker symptom relief as well, in case the DGL doesn't work. Yep. I love that you guys use the DGL so much. It's perfect. Super safe, way better to, I think it's good to mention this here. Way better than using something like Tums, especially during pregnancy. It's very common that women get acid reflux during pregnancy and use a lot of Tums. So, I remember when I was pregnant, just seeing women using it all the time. It was like candy. And what we don't often realize is there is a type of calcium in Tums that helps calm down that acidity and helps with symptom relief. But it can also calcify the placenta. So, OBs and midwives who have patients who have used Tums extensively, when they see the placenta, it will actually be white in color because it has calcified. And that means that it makes it very difficult for nutrients to pass through the placenta to the baby, and it changes the way that the placenta is able to function. So there can be health implications for baby as well. So as much as possible, I always recommend try to stay away from Tums. There are way better options for supporting acid reflux or heartburn that are super common during pregnancy as well. There's one here that says, how can you offer support through the IVF process or suggestions for any testing to do through that process? Great question. For you, I know that we've done some detoxification work. All of that is going to be really helpful for the IVF process. So I do really want to emphasize that. Anytime we're changing the terrain of the body and supporting hormone health as a whole, as we get into IVF, it can be really helpful in promoting success there, right? Because it's not a perfect process. It's not guaranteed by any means. In terms of testing, I would always say like some repeat blood work, which I think you've had done recently. So having some blood work that we're looking at, like what's happening with the thyroid. Are there any systematic stress on the body? Are there nutrients that are depleted that we want to address? Also looking at blood sugar, of course, as well. I would then be thinking about what's actually happening in the IVF process. So, for instance, one of the things that happens when you're doing IVF is there will be a period of time where you will be taking hormonal birth control in order to make sure that pregnancy is prevented, as you're kind of like leading up to transfer. And there are, of course, risks involved with those things. We're thinking about like antibiotics that are often prescribed with IVF. There are risks to those things. And so knowing those risks then mean that you can create a custom protocol to mitigate those risks. So for instance, with hormonal birth control changes the way that the immune system can function, and it can make it easier for things that are fungal in nature. Knowing that we all have normal amounts of candida in the gut that are supposed to be there, they're very healthy, can then start to overgrow. And that can change the way that things like estrogen is metabolized in the body, so it can contribute to things like estrogen dominance, and can therefore make the microbiome change a little bit, but also increase intestinal permeability. Knowing that that's the case, there's a lot of things that we can do. We want to make sure that there's like something like a probiotic in place. We want to make sure that there's healthy amounts of yeast. We want to watch for any signs of a yeast overgrowth occurring so that you can address it very quickly, and therefore take some more burden off of the immune system, which is very important when we think about the IVF process, because we don't want the immune system to be in an upregulated state, for instance, where it is trying to attack anything that it perceives as a foreign invader. When we're thinking about antibiotics, the same would be true. So we'd be thinking about like, what might this be doing to the gut, right? So is it killing beneficial bacteria? Can we use a probiotic? Can we monitor testing over time, especially when we start to bring in like hormonal birth control or hormones as a whole? Again, they don't function in a bubble, so we want to make sure that the thyroid is being managed appropriately. So I would be thinking about like potentially doing blood work every like 3 months or so as you lead up to things. And then, of course, one of the other things that we often do when we have couples going through IVF is we want to make sure that they aren't doing any detoxification too close to retrieval or transfer to make sure that things are in the best spot for that. Um, those would be the first things to come to my mind. It can always be something where it's like, hey, we touch base like on a quarterly basis as you're moving through that, but we can always figure something out there. Would love to talk about my dental experience earlier this month and ask you what I can do about continuing to heal. Yes. Do you want to share that with everybody?
Yeah. So just like a quick, this is why I did it. I've had rheumatoid arthritis, Hashimoto's, and off and on people are arguing about is it lupus, is it not lupus diagnosis. And it led to like what's called bone marrow edema. So it was really painful and limiting. And so I saw Deidre's post about her getting root canal teeth removed. And then both her and Anna also recommended, hey, I think you should just check out those root canal teeth and just see a biodentist. So I did. And so the plan was to just remove 2 root canal teeth because they were for sure leaking. Um, they were the bottom left molars. And so she pulled them out and then she was like, hey, Maddie, grab the mirror. Like, you need to see this. Okay. So I look and she could see into my wisdom teeth cavity and it was like a corroded pipe. It was like brown and black and like pussies. Hope no one's squeamish. Like it was so gross, but also really cool and just felt like super tangible to see. Like there it is. And she's like, it's for sure in the other like 3. So I went back 2 days later and like dealt with it again. And so even like this last bottom one, like she even said like, oh, there's for sure parasites in here because it was oily, I guess. But just like the debris that she pulled out of my mouth was disgusting and crazy. And I felt like that last one, it like opened up like a full like body like release, like made me cry just because like I could feel it. Um, and like my throat was on fire and she's like, good, your lymph nodes are like opening and like you're finally detoxing out like all this junk. Like you had this 20 years ago, you've been sick for 20 years. Like this is probably the huge like reason why. But just knowing like, okay, that's like the heart meridian, I think. My question is okay, now that yay, like I've got that like out and I do feel so much better. Like my fingers don't feel like they're disconnecting off my hands now when I do this. But I also am thinking about, okay, circulation, like there's still a lot of stiffness obviously in my joints, especially like my ankles. And so I'm wondering like, can I be adding something just to like circulate more and like help with like, I guess, lymphatic drainage or like whatever, just the inflammation in of itself.
Totally. Okay, I want to back up a little bit to explain a couple of things, and then I promise I will answer your question.
Yeah.
Okay, so those of you guys who don't know, I've had a number of teeth removed. One of which was a root canal. I've also had another tooth that just had decay. And the thing to keep in mind is that there's kind of 2 schools of thought when it comes to root canals. Some biological dentists say that all root canals are dangerous because we are leaving a dead organ, essentially, in the body, and they can cause decay. And the other kind of school of thought is like some are okay, some are not. And essentially what happens is root canals, because the teeth are going into the bone, they can cause what are called cavitations. Cavitations are essentially the decay or an infection of the jawbone itself, which can become very, very dangerous, just like any infection in any bone would be, which is pretty like straightforward. And so removing those teeth or those root canals, even if they are not like painful or anything, can be incredibly helpful. And a lot of biological dentists will actually test those teeth. So they can test them for things like bacteria, yeast, parasites, and even Lyme, which we often see. It's very common for us to see people who have teeth pulled and there is Lyme living in there. And it's like, oh, well, there it is. And I know you won't mind me sharing this either, Maddie, is like this was a little bit of Maddie's story as well as we're thinking about Lyme and we've done some Lyme work for her. So that is the beginning process of things, like getting the infection out. And then we're also thinking about, okay, we took this big burden off of the immune system and it takes time. So ideally, what they have done, hopefully, is done either something like ozone or PRP in the area where they're using like, so those of you who don't know, PRP is where they actually draw blood from you and then they use the white blood cells that your body has produced and they pack it into those wounds, which can be awesome and it speeds up healing in a big, big way. Um, as long as those things are done, I would be thinking about, I would definitely do some more lymphatic drainage. I would make sure that you have some level of binder support in place. For lymphatic drainage, you might even just think about like gua sha or like self massage on like your face and neck. If you're not yet doing the big six from Dr. Perry, that can be an awesome one, just to make sure that things aren't getting stuck. It's not uncommon when you like start to do like gua sha or lymphatic drainage on your neck. You're like, oh, and now I have lymph nodes swollen under my arms or in my groin, right? Those are toxins moving, which is a good thing, but we don't want them to get stuck anywhere. Um, so any level of lymphatic support, gentle is probably going to be better for the time being. I would, of course, be sure to monitor the area if there's like any pain, tenderness, anything like that. Don't be afraid to go back to your biological dentist to get additional ozone treatment. If you are open to it and you don't yet have one, you might consider getting a Therasage Ozone Bubbler. They have a dental attachment so that you can use it in your gums and like along your teeth. It's something that you can really safely use at home. It's not like the medical grade one where you like can't smell the ozone at all. You can smell the ozone a little bit, but that can be really helpful for keeping things clean. I had done that. The other thing that I often recommend is to do a diluted form of hydrogen peroxide with a little bit of baking soda in like a water pick. That can be incredibly helpful for like keeping gums and teeth clean and just making sure that like anything that's being pushed out during that process is staying gone and being killed. Um, in terms of circulation, I would really be thinking about like making sure you're hydrated, lots and lots of electrolytes, of course, like a mineral heavy focus. So whether you're using something like Element or Pickleball or Redmond Real, like anything like that, don't feel like you, I would not feel like you're going to overdo it. I would do more is better in those cases to help with circulation. Um, and then I would just think about like a high dose omega-3 fatty acid if you're not doing something like that yet. So like usually I would say in the ballpark of like 3 to 4,000 milligrams of EPA and DHA. So it's quite a lot. That can be really helpful for helping lower inflammation, but it's also going to help with cardiovascular health and circulation as well. So those would be the big ones I would be thinking about.
Okay, cool. Thank you.
Yeah, of course. What else? I know a couple of you joined. You are welcome to unmute yourself. You can put something in the chat if you have questions, want to talk about anything at all. What's the format for this meeting? It's really open. Any questions or game. You can ask me literally anything. I will give you my opinion. If I can't say something, I will let you know. But yes, you're welcome to ask me anything and everything. Okay, what are your thoughts on grounding sheets in the winter? Um, is there a reason you're thinking winter versus summer?
Yeah, I live up in the Rockies and it's hard to get out in the winter time. I typically can ground in the summertime. It'll probably, if I could get them, be a year-round use, but I just didn't know what your thoughts were, if they were effective or not.
Yeah, I've not used any personally, because I don't know enough about like a quality brand. I do know a lot of people use them and really enjoy them, so I don't think there's any harm in doing that. Of course, if you can get outside, all the better, of course. For grounding purposes, even if it's just like for a couple minutes, it doesn't take a whole lot of time to do that electron transfer when you're grounding ultimately. So I would keep that in mind too. But yeah, I think doing something like that in the winter would be really helpful. I think that's a great idea. And I would just also, even if you don't want to do something like that, I would just think about like overall EMF exposure while you're in bed. So like anything that's plugged in the room, where is your phone? Is it right next to your head? Do you have something like a Sleep Number mattress or something that is like a mattress that is plugged in? Those are like the worst. Alarm clocks, um, TVs, where like do you have a Wi-Fi router that's nearby your bedroom, things like that. So even if you weren't to do like the grounding sheet, if you were just to reduce those things, particularly in your bedroom, that might be enough as well. Awesome. Sick kiddos with lingering coughs. Walking pneumonia is going around big time. We didn't go to the doctor, but cough's still around at 2 weeks using Earthly Cough Be Gone. How else to support? Great job. You're doing a good job with the Cough Be Gone. I do love that product. I would do something like a nebulizer. So if you can get like a nebulizer for like 20 bucks, I think, on Amazon if you don't have one yet. You're gonna want to put distilled water in that. Start there. So a nebulizer is going to have vapor that comes out, and they typically come with different attachments. So like one can be like a full nose and mouth cover, some are like just a mouthpiece. It will make you cough, so just be aware of that. Kids usually love them. You can be like, this is like a Spider-Man mask, or like something, like it's a fun mask for them to do. They don't have to hold it on their mouth where they're like only being exposed to the vapor. So even if they were to hold it away and they're breathing in some of the vapor into their lungs, that can be helpful. We just want to kind of coach them on like actually like taking a full deep breath. If they cough, that's normal. The reason why that can be really helpful is that it will help essentially moisten or like help with lubrication of those mucosal tissues in the lungs so that they can detox. The coughing is actually a good thing. The coughing means their body is trying to get rid of something that's still hanging around in the lungs, but that might help speed up the process a little bit. And then the next step is you could take something like a drop of colloidal silver, for instance, and put it in the nebulizer and then have them breathe that in as well. It's not going to burn. Doesn't taste bad, nothing like that. It'll just taste like they're still inhaling water in the nebulizer, and that might go a really long ways. And then I would also think about something that's immunomodulating for them as well. So I usually like to use some form of like medicinal mushrooms to do that. 5 Defenders is what we typically recommend for adults. It's a capsule, so you could technically open it up for kids as well. There's one called Myco-Immune from Thorne that's a liquid. I believe it is an alcohol, so you're going to want to like mix it in something that tastes good for them. But both of those are going to have immunomodulating mushrooms in them, like reishi and cordyceps and things like that, to help calm the immune system down. So that might be something to consider adding in as well. And then think about like, get them outside, get them sunshine as much as possible if it's warm where you're at. Get them fresh air. That can go a long ways too. It's not uncommon. I don't know why we're seeing as much pneumonia this year, but there's a lot of it. It's like 20 times what it's supposed to be. I think it's more of like a fresh air. Think about the fact that we're inside more this time of year going into the winter, and that there's a lot more pollutants in our indoor air. Awesome. Do you have a clean product recommendation list, subs for detergent, soap, etc.? We don't. It's something that we are working on behind the scenes. We want to have a list. The problem usually becomes that things are always disappearing or coming on the market, and so it's like constantly needing updated. If there are particular things that you're looking for, like detergent, like laundry detergent, like we can always help with those things. I don't know if you guys are in our Facebook group. You guys are welcome to join the Facebook group. It is free. We answer questions there. That's a great place to put like, hey, I'm looking for this, because not only everybody else in that group can add what they're using, but then our team also monitors that and can add our recommendations there. So that's a little bit easier way of like, here's exactly what you're looking for. So that might be helpful. Detergent, I usually use like Eco or Branch Basics. Truly Free is another great brand. Soaps, I don't know what you're thinking of as like body soaps or like cleaning stuff. I use a lot of Branch Basics in our house, but that might be a really good way. If you want to tell me what exactly you're looking for, I'm happy to share that too. How do you troubleshoot health issues in your family, like as a family physician mindset? What's the triage process you might go through? I feel like I just list what all could be causing it and then rule them out one by one, then listen to intuition. But without knowing all the things, how do you like to break down the possibilities of health issue? One thing is children, but it's another with adults. That's where I have a hard time sometimes. The only benefit is that I can have my husband try a lot of aggressive things. If it's not helping, just go through the other possibilities. That's what I do, those guinea pig husbands. So can you give me an example of like what you're thinking of, sort of things? Um, when I'm triaging things, so I generally take a less is more approach with family stuff. And I do more acute care. So like I have this, I mean, everybody, I feel like once you get into this space has this like graveyard of supplements that lives. Um, I tend to have like a huge like graveyard of things that I'm just pulling from acutely. It's not stuff that we're taking all the time, but it's more things of like, if we had this issue, here's what I would grab. Um, I think having like, it doesn't have to be as extensive. I know this is a question we've gotten a lot, is like, what are the things that we should have like with children or whatever? Um, we use a lot of like really gentle antimicrobials, so things like colloidal silver, I use a lot. Um, Biocidin is another one that I use a lot, super safe for kids. It's a liquid, you can dose it real low. I use that one all the time. Even like the Para 3 product is a liquid that you can use with kids at low dosage as well. So it's great for like colds, coughs, things like that. I also use a lot of homeopathy, more for symptom relief. So I use more homeopathy when it's like flu season. We'll use the one that I'm totally gonna butcher the name, the Oscalicum, well, that one, the long name one, for like flu stuff at the onset of symptoms can be really helpful. We use a lot of arnica for pain. We use a lot of chamomilla for whiny children and just being moody adults in general. So we use a lot of those things. Um, a rash, I'm thinking more like I'd be thinking more about like gut health stuff. So I'd be thinking like, is constipation occurring? If so, how do we get that moving? Something like a magnesium, something like that could be helpful. I'd be thinking with a rash, I'd be thinking about that. Potentially some type of like other exposure as far as like what might be causing that. If it's itchy, thinking about histamine and slowing down histamine, maybe something like a DAO or like histamine herbs like quercetin can be helpful for calming down those type of responses. Back pain and joint pain. Um, that's a trickier one. I've honestly been using my Healy a lot more for that type of pain. It can be really, really helpful. I know Madeline has a Healy too, so I'm sure she can share how she's been using hers, but I use mine a lot for joint pain, back pain and stuff, which I get at least once a week. So that can be helpful. Maybe even like arnica, whether it's topical or oral, can go a long ways there too. You just might need a higher dilution of that. Perfect. Yeah. Write the example for your dad for me in here. Um, okay. Castor oil works well for joint pain too. Great. Yep, absolutely. Let's see here. Yeah, so I would say like with when I'm thinking through something, I'm thinking about like acute symptom relief, and then I'm like then able to take the time to work through like why is this actually happening? It's usually like stress, blood sugar, gut health, some type of immune challenge that's come about, sort of thing. And then I'm thinking about how do I actually work through that? Is it just more the immune system needs support rather than something needs killed? Okay, there's one here that says, do y'all have the ability to test hormones? I'm going back and forth with my OB about getting levels tested through my cycle, since in their eyes I haven't had any issues or miscarriages. She's not pregnant yet, but prepping. About progesterone in particular. Yes, we can. We can do that via blood work. We also have a number of other tests for hormones that you can use. So blood work isn't always the best option, but it is recognized from OBs. So if you want to do something like that, we can certainly get you pricing for that. Your other options would be to either do a salivary or a dried urine test. A dried urine test is typically what I recommend. We use the Dutch Complete to be able to do that. So it's a single sample collection between days 19 and 21 of your cycle. It will test not only your sex hormones, but also adrenal hormones. So we know everything's connected, but you can give you a good idea of like where things are at. Is there anything that needs support? Yada, yada. Salivary testing is a little bit different. Salivary testing is going to require that you're taking 11 samples over the course of your cycle, so collection is a little bit more intense, but gives you a lot more data points. Salivary testing is going to show you not only true progesterone levels, whereas the Dutch is only going to be showing you metabolites. Metabolites essentially means that we might be missing something, but I usually prefer doing the Dutch complete over a salivary test because it's a lot more simple and it gives us an idea of what's going on. The salivary test is also going to show you your estrogen. It'll show DHEA, which is one of your adrenal hormones, but it won't show you cortisol levels. It'll show you testosterone. And then the other big advantage is it will show you your pituitary hormones as far as FSH and LH to make sure those are working. You can also test FSH and LH on blood work as well, but just to kind of give you an idea, the cheapest is going to be doing blood work. The most expensive is going to be doing the Dutch, just to give you a kind of ballpark. The high end is like $315. Perfect. You want to tell me about your dad, Ashley? You can unmute yourself too if you'd like to. And I know you might have kiddos around. Okay. What else? We got about 5 minutes. Oh, perfect. Okay. My dad needs oral expansion work done and eventual tongue release, so we just started working with a biological dentist and have been doing a night lace procedure first to tighten soft tissue in his mouth. Now, this is the question. We think his constant reflux issue is related to both his mouth and his gut. After doing his first night phase procedure to expand his mouth, he started burping constantly, day and night, unrelated to eating. Isn't that bizarre? He thinks it's a hiatal hernia, but after looking more into it, I think it could be H. pylori. The dentist has no idea. Typical. It's got to be a gut thing that's starting to react to mouth salivary changes. Yeah. I would be thinking about gut health for sure. It could be H. pylori contributing, so it's not uncommon to see not only like reflux be related to H. pylori overgrowth in the stomach, but also like that burping. Or I also see a lot of people who have H. pylori have like really common hiccups. And it is just because the pressure in the stomach changes and it can cause spasms there, even into like the diaphragm as well. I would be thinking about something like H. pylori. So that could be a big factor. If he is still having reflux, the first thing you're going to want to ultimately do is do some of that like upper GI healing work. So DGL, Gastrozyme, slippery elm, the aloe vera juice can all go a long ways for like calming that down and kind of probably helping even like with the burping. And then ultimately you might need to do some eradication of the H. pylori as well. There's a lot of different ways to do that. The thing I would also emphasize is that H. pylori can sometimes be protective. It's a lot more common to see this with children, but it is true in adults as well, where H. pylori can be protective and be growing there in an attempt to help and be protective. So bacteria in any way are decaying tissue, and when they are decaying tissue, it's because the tissue is damaged. So the question then becomes, why is the tissue damaged in the first place? If he has any other symptoms, one of my first places to point might be a mold issue, even if it's a past issue. It may very well not be like a current issue unless you're like, oh yeah, he totally has mold in his house. But there might be something that's just kind of long-standing as far as an exposure that's creating some type of toxicity in the body, and that H. pylori is there to like help break down those tissues to allow them to heal and regrow. Awesome. Yep. Happy to talk with him if he is open to it. Any last minute questions? Okay. Well, I really appreciate you all coming and listening in and chiming in if there's things that we can help with. We're gonna plan on doing another one in November. Like I said, it's recorded, so it will be in the virtual education library, probably by tomorrow. And what we're going to do with each of these calls as well, so that you know, is it will be recorded, you'll have the video, we'll have a full transcript of it, and it's going to be all time-stamped as well. So you'll be able to see like, here's the questions or topics that came up, so you can just like fast forward to that point in the video if that's what you wanna learn about, rather than like watching the whole hour, which I know is a big ask. We'll probably also start sending out some forms ahead of these calls. So if you have questions but you can't make it live, you can put your question there or ask those things, and I can address them on the calls. And then for those of you who don't yet know, Michelle is going to be starting next week. She is also going to be doing a fertility specific community call. So I believe that's on Tuesday next week at 5 p.m. Central Time. For anybody who is trying to conceive, maybe in the preconception spot, if you're going through IVF or IUI or anything like that, or you're just working with us through a protocol right now, we really want to hold space for everybody so that they can talk about their concerns, their fears, things they're struggling through, just so that you guys know that you're not alone. And we'll be expanding this more with the rest of the team as well, but we're just getting ramped up to offer some new things in the new year. Okay. Thank you guys so much for coming. I'm glad this was helpful, and I hope I will see you guys again soon. Bye.